Hey, Tony, how are you doing this morning?
Hey, what's going on there, Dr. Josh?
I'm just living the dream. I love these Tuesday morning hangouts with you, bud. Tell me something good going on today.
Coffee. That's what's going on today. How about you?
I have my coffee. I don't know if you can see it.
What kind of coffee are we doing today?
Starbucks special.
What's wrong with you?
What are you doing over there?
Oh, we're gonna do. We just hand ground using the Java press some Costa Rican beans, 27.3 grams to be exact. And what we're gonna do is do a nice little 17-to-1 water ratio using our Chemex right here. So I'm gonna start here with a 30-second bloom. So we're going to make this right here as we go today. I'm really excited about this because this is some good coffee. We're going to be doing 464.1 grams of water. We're going to pour through this today. I'm pretty excited about it. So I hope you enjoy your Starbucks special. That's pretty awesome, dude, if you're into that kind of thing.
I love it. Hey, I really want to share this with my people down here, and I'm just going to have to share your post, okay?
Do it.
All right. Yeah.
Oh, I got to make you able to do that. That's on the list of things.
It's okay. Listen, I'm a professional here. I can maintain while you figure your life out up there.
Yeah, you know what? You just start talking, and I'll get you ready to be able to share this.
All right, I appreciate it. So guys, one of the biggest things that we wanted to come to you and talk to you about is how important life-saving medication is and why you need it, and sometimes why it can be dangerous long-term. So first of all, I'm all about having your life saved. A little background, December last year, that was 2017, I had to go to the hospital. I developed this hole in my lung, and you should not have a hole in your lung. I think we can all agree on that. And it was letting air out of my lungs into my chest cavity, and it created all kinds of problems. I had to go to the hospital. I had to get all fixed up. They gave me drugs. I took them. I had to take them. Life-saving medication has its place, but we really wanted to be able to come to you and share some information that I just don't think that you're going to get anywhere else. And it's that there's some really long-term negative side effects of some very common medication. And the one that we're going to talk about is the antibiotics, and which one? The antibiotics and acid suppressive medications, specifically for kids, right? So now listen, before you run out and you dump all these things out and you make all your decisions based on something that you saw on the internet from me and Anthony, what you need to do is you need to make sure that you actually have your best interest at heart. You can consult with us one-on-one. You can consult with your general physician. You can find out what we're talking about. Is it right for you? So definitely, that's my clause. Stay safe. But what we wanted to let you know is that JAMA, Pediatric Research Mag Journal, just came out with some information that talks about how kids, it's these little infants that when they're being prescribed these acid medications and antibiotics, develop an absolute slew of healthcare problems later on. And this is statistically higher than kids that just don't have to take those. And so what do they get? And I'm going to make sure that I post this on my end when I can get this reposted, Tony. And I'm going to make sure that you guys can have this information because it's so important. So some of these things that these kids are having, they just have a higher percentage of all the allergic diseases like asthma, allergic rhinitis. This is like hay fever. Anaphylaxis, which is common congestion, and contact dermatitis. This is red, itchy eyes. As Tony's making his coffee, it's beautiful. Food allergies. How many of you know people that have food allergies as they get older? Yep, I know plenty of them. Being allergic to different medications, also allergic conjunctivitis, and that was a nice long word, just meaning that you have red, itchy eyes due to allergies or pollen or hay fever, things of that nature. So listen, again, life-saving meds, there's a place for them. Like I said, I had to have my life saved with some medication last December. Boy, am I happy for me, my wife, my family, my boy, that I had that stuff. But if you're just resorting to these things as a first line of defense, and you're constantly taking these things. And it's so common for you that you let it be common for your spouse, and you also let it be common for your child, and you don't think twice about it, and you don't understand that there's these long-term problems, then you're really just kind of treading on some dangerous long-term health problems. And the rest of the time, we're going to fill in the gaps with what you can do to best avoid these problems and what you can do today, actually today, to help your body naturally instead of relying on unnecessary medications, especially when there's a better way. All right, boom, Tony, that's what I had. What do you want to talk about?
Yeah, that got me really fired up. So basically, when you kind of go through the research that the American Medical Association just came out with, which I think is awesome. Kudos to those guys over there, because sometimes it's really hard to go against and to come out with information, or to really talk about information that says that's just against what your organization has been doing for years. It's been what they even talk about in the research is that it's been pretty well established. There's been a shift towards showing that anything that changes the normal gut bacteria is not good long term. Mm-hmm. So what they decided to do, what researchers over at the AMA decided to do, was look at individuals who are part of our armed forces and part of our military, because it's really easy to study them because of the way the TRICARES, which is the military insurances database, works, which on a day like 9/11 really makes it just really hits home. You know what I mean? But what they did was they looked at all of these military personnel and looked at their kids. They looked at all the diagnoses that have been given and all the medications that have been given to kids, and they decided to go ahead and look at any child that was born between, I think it was like 2001 and 2013, so like 10, 12 years. And they looked and they saw that anybody who had been given an antibiotic or a reflux suppressing medication, and they looked and they saw what the rates of these allergic diseases were that came up later. What they found is two, three, depending on how you look at it, really significant things. One is any child who takes antibiotics or reflux meds, acid suppressing meds in the first 6 months of life is statistically more likely to get all of the different things you mentioned about allergies, asthma, etc. Right? Now, for the reflux meds, what they found was something that was really interesting, which was that the more days that this child had taken this medication, they called it was a dose-dependent relationship. So the more days that they ingested this medication throughout those first 6 months of life, the more likely they were to have that come up later in life, which is pretty interesting, right? Right, Dr. Josh?
Yep.
What was really cool, I thought, not cool, actually, for antibiotics was that there was no dose-dependent relationship. If you had one round of antibiotics in your first 6 months, it was the exact same risk of asthma, which was more than double people who didn't do this, more than double the people had asthma. If you had one dose of antibiotics, you had the exact same risk as somebody who had 10. That's pretty significant.
So I think what you're saying then, that there's not really a safe amount.
Exactly, right. And like you kind of mentioned earlier, I mean, these can be be life-saving. I believe I was an EMT for 10 years. My wife is a nurse. My family's been in first aid for years. I believe in drugs and surgery. My father is a cancer survivor. I believe in drugs and surgery, but I believe in them, and I think so many people listening to this do. I believe in them as a last resort, an amazing last resort, and not a first option.
Yeah. And we're doing it a little bit backwards in American healthcare, where everybody just rushes off to make it the first line of defense, which it's pretty socially accepted. Can't really understand that when you look at the evidence. But when you know that there's a better way, you should definitely look into the better ways, try to be as healthy as possible without risking all these negative side effects. I just think that there's too many things down the road that you wish you had known. How about this? I know you're the exact same way as me. So I meet people all the time and they tell me, I wish I had known this earlier. All the time that I spent, all the problems that I had, all the back and forth, sick for a while, kind of feeling better for a while, more meds, less meds. You take one and then you trade it for two, and then you take two meds and you trade it for three, and then it's back to one because it's something that's new and better. All of a sudden, where'd all your time go? Where'd your health go? And why can't you be healthy is the big question.
Absolutely. Oh, and we got some. We have some comments as well down here. So first, somebody wants to tell you, Dr. Josh, that you're awesome. I don't know if you can see this on your end, but Ashley Hasty says y'all are awesome. And then somebody asked for a link to the study as well, so we're definitely going to go ahead and put that up. So when it comes to what better,
I'll post that.
What's that?
I know Heath. If that's the Heath I'm thinking about, I'll get that posted up.
Hey, Heath. We'll get that out there for you. Awesome, guys. Thanks for watching. Any questions or comments or anything like that, please go ahead and put it, and we'll go ahead and address everything that we can here. But yeah, in terms of if we believe that medications, drugs, surgeries, etc., are a last resort and not a first option, what, Dr. Josh, would you consider to be some first options?
Man, it just goes with working with the body instead of against the body. I mean, there's nothing that I'm really going to rattle off that we don't know intuitively, besides maybe I'm going to recommend getting a chiropractic checkup. Everything else is going to be pretty intuitive. We have to eat clean. We have to exercise. We need to be out in the sun. We need to stay hygienic, but not overly hygienic, keeping your hands sanitized all the time. That's something that society pushes towards. That's really amazing. And yeah, if they're gross, wash them. That's a no-brainer. But at the same time, if you're never getting any germs in your body, how can your immune system learn how to function properly? And I use that word function purposefully because if your body just starts to react crazily and it's never been introduced slowly to some germs, of course you're going to have more health issues as you get older because your body's going to try to fight it off harder. But I definitely recommend having a good diet, good exercise, good way to center your mind and your body, whether that's quiet time, exercise, meditation, whatever you want to call it. But chiropractic checkups being pivotal because, big shocker, there's tons of research that points to the functioning of the nervous system and the functioning of the body overall working better when your body doesn't have neurological stress on it, which is exactly what chiropractic fixes.
Heck yeah, absolutely. And something that I really like to really be clear on is it's when we talk about the mindset of this, right? I believe we've talked about this, that chiropractic is not a treatment for anything. For anything. What do I mean by that? You're not going to come to me and get a reflux, like a reflux adjustment. You're not going to come to my office and you're not going to get the antibacterial adjustment. And often when we have these conversations with people, it's like, well, what's a natural alternative, for example, to antibiotics? And that's awesome. Like, I love natural alternatives, but that's still something that is a treatment for a specific symptom. What I believe is that the most important thing for families to do, for people to do, is to, first off, the first line of defense is that, right? The first line is to create the environment for health versus just simply naturally treating symptoms. I think the natural treatment of symptoms should be the second line, but the first is creating the environment for health, right? And now when we talk about chiropractic and kiddos and families and even the decisions that you make, right? Choosing to eat broccoli over Skittles, even if they're broccoli flavored Skittles, right? I'm glad you like that.
Yeah, that's good.
Sorry, that was the first time I said that. I'm probably going to say that from now on. Choosing to eat broccoli over Skittles, these are all just decisions that are meant to boost health. Now, I believe that birth can be a traumatic experience. I talk about this all the time. I personally haven't given birth. Dr. Josh, have you given birth?
Nope, I was there for Ashley though.
Yeah, you've at least seen it, right? It can be a traumatic experience on the head, on the neck, right? It can be traumatic for both mom and baby. So what we want to do is let them get the best start to life possible. Analyze for places where the bones of spine have misaligned, putting tension on the nerve system, which, by the way, controls and coordinates the function of every system in the entire body, including the immune system, which is what we're talking about with things like antibiotics. Controls and coordinates the function of every system in the entire body, including the immune system. Analyze for areas of interference there and correct it very gently, very specifically, very scientifically, using evidence-based techniques and practices. Whew, I'm fired up now. How about you?
I love it. I love it. Yeah, I think that we could go on about this for hours or days, really. I mean, I know you could go on forever about it.
Probably will. I'm going to put something pretty cool up on the screen here, Dr. Josh. We got a comment right here that Danielle is watching. She said, you guys just, and then she had a typo, so I'm put it back up. You guys just changed my way of thinking. I mean, that's pretty cool. Is this what it's about, right? I mean, like, I don't want people to just go run to their medicine cabinets and be like, oh my gosh, prevention of this, let's throw out all the meds. Like, no, that's not what it's about. But what it is about changing our mindset, shifting our mindset to recognize that true health is not the presence or absence of symptoms. It's not. If you're basing your health 100% on, hey, I feel good today, so I must be healthy, I think we're missing the ball here, right?
Oh, absolutely. Well, when you base your health on how you look and how you feel, you're missing all the top reasons that you're going to end up losing your health. When you focus on look good, feel good, you ignore the top reasons that your body is decaying on the inside, that you're going to lose your health over time.
Yeah. So when we talk about people making positive health decisions, it's really cool to have people say, hey, my baby's not spitting up anymore. Get that all the time. Hey, I don't have migraines anymore, right? Get that all the time. But it's even more rewarding to have, for me personally, to have people talk about what that means and what health means, which is, hey, I don't have this pain anymore, so now I can go play t-ball with my son, right? What are the kinds of stuff that you get to hear when it comes to actual health, right? Not the presence or absence of symptoms, but actually living our best life possible. But give me some things. What are the things you've heard recently?
Oh man, I love it. When I'm working with people, I always ask them, hey, tell me something good that's going on today. And by being in a chiropractic office, it generally kind of get back like, oh, my back doesn't hurt today. And, I know that that's really common, so I understand why they're answering that way. But I just redirect the question again, and I'm like, so cool, your back wasn't hurting over the weekend. So then tell me all the great things that you got to do with your family that you weren't able to do when your back was hurting, or whatever other symptom that they are telling me that they're having success with. I always redirect it back to their quality of life. So, how did you, great. So then you enjoyed your vacation to New York a whole lot better than you thought you would. And so it's all these great things that I get to talk to people about, because as we go through and we facilitate this health and healing environment of their body, quality of life goes up, and it's pretty awesome.
Yeah, I love it. I love it. I'm fired up today, Dr. Josh. What are some things that we should leave people with here? What are some closing thoughts for you here, Doc?
I'm going to close it how I opened it so that it doesn't get taken out of context. Listen, life-saving medication is there for a reason. Absolutely. Like I said, hospital visit last December, hole in my lungs, could have died. It was that bad, had air leaving my lungs, going to my chest cavity in an area that it shouldn't be. Clearly, everybody knows that's not supposed to happen. And if it wasn't for life-saving meds, I may have not have made it. But when we use it as a first line of defense and we don't really think about long-term problems, that's where you're going to start to get into some trouble. So my exiting remarks is going to be smart. First of all, disclaimer, talk to your doctors, go and ask your doc. But if you're just doing it blindly and you're not really sure about long-term effects and if it's for you or not, you need to be educated. It's all about the education process. Ask questions.
Remember, health is a choice, and your health choices are just that. They are choices.
choices.
That's what I got.
So I know that we had a comment for getting that research article posted. I'm going to get that posted as soon as I figure out how. So there's that. And that'll be posted on both of my pages. I'm sure you'll do the same for your people too, Tony.
Mm-hmm. Yep. Will do.
Awesome.
Right, hey, man, appreciate you once again. I'll talk to you. Well, I'll talk to you before next week, but I'll talk to you next Tuesday.
All right, everybody. Have a great rest of the day. I appreciate all you. Thanks.
You too. Bye.
Bye.